about time for us to take our health segment this Tuesday morning. And we have with us once again Dr. Olatubi Olawale, an alumnus of the College of Medicine of the University of Lagos. Now, he has a very long CV. Let's start. Physiotherapist, specialty in sports and orthopedics and rehabilitation. He's also a member of the Nigerian Society of Physiotherapists and a member of the American College of Sports Medicine. His special interest is in injury prevention in sports. Now, his understanding of the intricate connection between physical and mental well-being has expanded his scope of practice to mental health as well. But today, we are discussing injury prevention and, of course, management. It's great to have you back in the studio.
Thank you very much, Titi.
All right, so when it comes to injuries, I can still remember the fact that, you know, my mom especially didn't want me to go into any kind of sport because she was always afraid that, you know, something could happen. Some bone could break or some ankle could twist. Let's talk about the most common injuries that happen, especially with regards to sports and exercise.
Yeah. You don't even have to go into sport or any exercise before you have an injury. You can be walking and just fall on just sprain your ankle. So the common injuries we have sprain, strain.
Okay.
You can actually sprain your ligaments. Your ligaments can just be sprained while exercising or while doing any sporting activity. Then you can have fractures. That's one of the worst kind of injuries you can have as a sport individual.
Yeah.
Breaking of any of your bones. Then you can have dislocation. Dislocation is when when the joint is pulled out of its normal position.
Wow.
There's a difference between dislocation and fracture. Most people confuse both of them together. And you can have tendinitis. Tendinitis is...
So that's the tendons.
Inflammation of the tendon. Wow. Because majorly is actually used because of overuse of that joint. The tendon gets inflamed. That's tendinitis. And also another kind of injury you can have is concussion. You can have a hand injury. You can have a brain injury. Probably you fell on your head. That's one of the very crucial injury you can have. You can have shoulder dislocation. You can have knee tears.
So these injuries now are the things that people, you know, just don't want. They don't want anywhere near them because anything to do with bones or limbs means that you are limited in your movement for a period of time during the healing process. So let's talk a bit about the prevention now. How to prevent these injuries from happening at all.
First, one thing we have been saying every time is that exercise and sporting activities or physical activities is important for your well-being.
Okay.
You don't have to go to play football. Just make sure that you involve yourself in any kind of physical activity or exercise. We all know that it helps to prevent a lot of cardiopulmonary, cardiovascular injuries and everything. Now, how to prevent them? One of the major things is warm up and cool down.
Warm up and cool down.
Now, before you go into any exercise, you need to warm up. Then after the exercise, you cool down. Because it takes time for your body to just adjust to kind of any exercise. So you see those from footballers.
Yeah.
They just go into the field and play football. Wow. They do training, they play, they warm up, they do training, then they play. Then after playing, while everybody had gone home, they come back to the pitch to cool down their body.
Okay. So this warm-up, what does it comprise of now? Because I feel like warm-ups are also exercise. Am I wrong?
No. Warm-ups are not exercises.
Okay.
Now, for example, I want to play football.
All right.
It's time. I just went to the field and start playing football. Without any warm-up. Before I go to play football, I take some light jogs around, making my heart and my heart to actually start preparing for the rigorous exercise you want to do.
Sure.
Then I do some stretching. Exercises to make sure that my muscles are well relaxed. And if I do that warm up very well, the chances of me having injury is going to be very, very slim.
Okay.
Then also cool down is very, very important. Another preventive measures again need to do is that actually progress your exercise. The intensity of the exercise and the type of exercise, you progress it. You just move from 0 to 100.
So now for those who maybe have been doing exercise maybe in year 2020 and they decide to come back, maybe they were pushing weights of like maybe 50 kilos or 60 kilos in 2020 and then they come back in 2024 and say, okay, don't worry, I was pushing 50 then, I think I can go higher. You know, what would you advise? Would you advise that they stay with the weight that they were used to or they start smaller?
So I would advise to start smaller
Okay.
because it takes time to 2020 to 2024 is like 4 years.
Okay.
Now, if you be pushing 50 kg in 2020, now your muscles are actually relaxed. And for you to now want to go back to pushing that kind of weight, you can probably start with 25, 30 kg, and gradually progress to 50, progress to, even if you want to go higher, just make sure that the progression is gradual. Because if you just go to 50 at once, you might actually strain your muscle.
I know some people that, maybe they jog around their estate and all that. Maybe they started jogging some years back and then they stopped and then they want to start again. And they're used to jogging around the estate like twice, 3 times. What would you advise if they want to get back?
We've had issues where people were jogging and they slumped and they died.
Wow.
We've had issues where people were doing exercises and they slumped and died. Well, that's one thing about preventive measures now. You need to take it slowly. If you've been jogging 15 minutes, 20 minutes before, and you stopped, if there is a stop in any exercise you're doing, when next you are going back to it, you progress. You start from small. You don't just say, because I've been doing 20 minutes, let me push. Okay. Another preventive thing is that listen to your body.
Okay.
If your body is telling you to stop when you're having pain or when you're feeling dizzy, listen, then stop. Some people try to push beyond their limits. Their body is telling them, I'm tired. There's a saying, they'll say, no pain, no gain. No, in medicine, we really don't like that statement.
No pain, no gain. in fitness and workout, even the instructors say no pain, no gain.
Yeah, no pain, no gain, because actually after exercising, your muscles feel sore and everything, which is normal. But there's some kind of pain you feel that you know that this pain is not normal. Please stop at that time.
Okay. So I know this is like old wives' tales or myths. I hear there's some vitamins, some nutrients, and some things you can eat that actually help to prevent injury when you start working out or start doing any kind of physical fitness.
I would just advise to take balanced diet and water. Always hydrate yourself. Then take balanced diet. Balanced diet as we are using a food with a balanced diet, protein, carbohydrates, fat and oil, vitamins. Take balanced diet. Now, if you don't have the means to take balanced diet, fine. You can probably go take some supplements to supplement any deficiency of nutrients you have. But I always advise balanced diet is the way. Eating a well-balanced diet. Okay.
So those injuries are not always just because of some nutrients that are lacking in the body?
No. It's just because of overuse sometimes when you overuse a joint. And sometimes, and management too. If you want to manage this kind of injuries now, first of all, you rest. After resting, sometimes you need to apply ice.
Okay.
Sometimes if there's a swelling, you need to elevate, and sometimes you need to bandage. Sometimes everybody when you have an injury, they just say, oh yeah, let us rub it. They start pressing and...
No, pressing is not always the answer.
Pressing is not always the answer. Sometimes when you press, you may even cause more injuries.
Okay, all right. So the same way, we note in sports that if, for instance, a footballer has an injury, you never see them pressing it.
At all.
They probably spray it with something first and let it cool down, or maybe use an ice pack.
Ice pack, yeah.
Well, you know what, Dr. Olatubi, I know that there are people that have questions at home. We can't wait to see them. Use our hashtag #WakeUpNigeria on TVC and tag us WakeUpNigeria TVCE with them, and we'll see if we can answer them towards next week.
Thank you.
Thank you, Doc.
It's always a pleasure.
See you soon.
Yeah.
Okay, then there is still more. Of course, let's take a quick break.